Right now, somewhere in your body, a process may have already started that you cannot feel, cannot see, and would never suspect is happening. It does not cause pain, it does not wake you up at night, it does not show up in your annual blood tests, and by the time it does announce itself, in most cases it has been quietly growing for years, sometimes a decade or more. Lung cancer kills more people every single year than breast cancer, prostate cancer, and colon cancer combined. Not because it is uniquely aggressive in its early form, but because it is extraordinarily good at staying hidden. The symptoms it produces in its early stages are so ordinary, so easy to explain away, so perfectly disguised as things that happen to everyone, that most people brush them off for months or even years. A cough that lingers a little longer than usual, feeling slightly more tired after climbing the stairs, a mild ache in your shoulder or back that you assume is posture or sleeping funny. These are not dramatic symptoms, they are the symptoms of a Tuesday, and that is exactly the problem. The most dangerous thing about lung cancer is not what it does to you eventually. It is what it does not do to you early on. It does not scream, it whispers. And most of us have been trained either by our own optimism or by a healthcare system that treats symptoms reactively rather than proactively to ignore the whisper and wait for the scream. What we now understand from decades of research into early-stage lung cancer outcomes is that the gap between a whisper and a scream is precisely where lives are saved or lost. Catch it while it whispers, and the 5-year survival rate can exceed 90%. Wait until it screams, and that number collapses to under 10%. In this video, I am going to walk you through 11 early warning signs that most people either miss entirely or dismiss without a second thought. Some of these will surprise you. Some of them are happening to people right now who have no idea they should be concerned. By the end, you will understand exactly what to watch for, why these signs matter biologically, and what to do if you recognize them in yourself or someone you care about. Hi, I am Dr. Alex. I am an emergency medicine doctor, and after nearly 10 years in the AANDE, I have seen what happens when preventable disease is not prevented. I have stood at the bedside of patients who came to us far too late, patients who had noticed something months earlier and told themselves it was nothing. And my goal now is to help people avoid getting to that point in the first place and to live longer, healthier lives. If you are watching this video, you are probably concerned about your health or the health of someone close to you. And I just want to take a few seconds here to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research to help you understand your body and catch problems before they become crises. All I ask in return is that you give this channel a chance and hit the subscribe button. If you get to the end of this video and you did not think it was worth your time or you have not learned something new, then feel free to unsubscribe. No hard feelings at all. But if you give me your time and your attention, I will give you everything I have learned from over a decade in medicine. So please help me out. Hit the subscribe button to help this channel reach more people like you. And let us get into the video. Before we go through the 11 signs, we need to spend a few minutes understanding why lung cancer is so effective at hiding. Because once you understand the biology, the symptoms will make complete sense and they will be much harder to dismiss. Your lungs have a remarkable feature that works against you in this context. They have no pain receptors in the tissue itself. The outer lining of the lungs, called the pleura, does have nerve endings, but the actual lung tissue where most tumours begin does not register pain. This means a tumour can grow within the lung for months without producing any discomfort whatsoever. That is not all. The lungs also have a significant amount of what we call functional reserve. Think of this like a battery that still shows a charge even when it is getting low. You can lose a meaningful percentage of your lung capacity before you notice anything in your breathing during normal daily activity. It is only when you ask more of the system, climbing stairs, carrying shopping, walking briskly, that the deficit becomes apparent. Here is where it gets really interesting. Lung cancer does not only affect the lungs directly, it affects the body through multiple pathways simultaneously. The first is local invasion, where the tumour grows and begins to press against nearby structures, airways, blood vessels, nerves, and eventually the chest wall. The second is systemic effect, where the tumour releases proteins and chemicals into the bloodstream that alter how your muscles, joints, nervous system, and even your fingers behave. The third is metastatic spread, where cancer cells travel through the lymphatic system or bloodstream to reach other organs before the original tumour has been detected. What this means is that the early signs of lung cancer are often not lung signs at all. They are signals from other systems reacting to the presence of something the immune system and the body are trying to deal with. That is why a swollen finger, a strange rash, or unexplained weight loss can all be the first signal of a lung tumor that has not yet caused any respiratory symptoms. This is also why the traditional framing of lung cancer as a smoker's disease that announces itself with a terrible cough and breathlessness is so dangerously incomplete. Research published in the journal Thorax has shown that a significant proportion of lung cancer patients experience non-respiratory symptoms for months before a diagnosis is ever made. Knowing what those symptoms look like is not just useful. In many cases, it is the difference between stage 1 and stage 4. And just really quickly, before we get into the signs, if you are getting value from this video so far, please consider subscribing to the channel. It genuinely helps these videos reach more people who need to hear this information. Anyway, let us continue. So let me name these 11 signs explicitly, because this is the information most people never receive from a routine appointment. These are the patterns I have seen repeatedly, both in clinical practice and in the literature, that precede a lung cancer diagnosis, often by many months. This is the most common early symptom, and it is also the most frequently dismissed. We all get coughs. They come with colds, with allergies, with dry winter air. Most coughs resolve within 2 to 3 weeks. When a cough persists beyond 3 weeks without an obvious cause, that is the body signaling that something is interfering with the airways in a way that ordinary mucus clearance cannot resolve. A tumor growing near or within an airway triggers the cough reflex continuously because the body is trying to clear an obstruction that cannot be cleared. The cough may be dry, or it may produce a small amount of mucus. What matters is its persistence and the fact that it does not fit the pattern of a normal respiratory illness. Any cough lasting more than 3 weeks without a clear explanation deserves a conversation with your doctor. That is the threshold. Not because every persistent cough is cancer, but because it is the threshold at which the body is telling you something needs investigating. This one is particularly important for people who already have a chronic cough, whether from smoking, acid reflux, or a long-standing respiratory condition like asthma or bronchitis. When a cough that you know well suddenly changes, it becomes deeper, more frequent, produces a different kind of mucus, or starts happening at a different time of day, that change is a signal worth paying attention to. The reason this matters biologically is that a new tumor alters the local airway environment. It changes the amount and character of secretions, it narrows the airway in a slightly different way, and it stimulates a different pattern of cough reflex activation. Your body, in other words, is producing a different cough because something different is now present. Remember the functional reserve I mentioned earlier? This is exactly where that concept becomes practical. If you have started noticing that climbing a flight of stairs, walking to the end of the road, or carrying a bag of shopping leaves you more breathless than it used to, that shift in your baseline deserves attention. A tumor partially blocking an airway reduces the efficiency of airflow in and out of a section of the lung. The remaining lung tissue compensates during rest. But when demand increases with physical activity, the compensation breaks down and breathlessness appears. The insidious thing is that this change often happens gradually, over months, and people adjust their activity level downward without realizing they are doing it. Gradual breathlessness that you have been quietly accommodating for months is not a normal part of aging. It is your body asking a question that needs an answer. Even a small amount of blood in mucus, what doctors call hemoptysis, should never be dismissed. I want to be direct about this one because I know the instinct is to hope it was just a throat irritation or a burst blood vessel from coughing hard. Sometimes it is, but blood in sputum is one of the most important red flag symptoms in respiratory medicine, and it requires same-day medical evaluation. What happens biologically is that a growing tumor develops its own blood supply through a process called angiogenesis. These new blood vessels are fragile and poorly formed. When coughing creates pressure in the airways, these vessels can rupture and bleed into the airway. Even a teaspoon of blood in your sputum is the body giving you a very clear signal that something inside the airway is not normal tissue. Chest and upper back pain that is not related to an injury, that does not change with movement or position, and that cannot be explained by a muscle strain is a symptom pattern that warrants investigation in anyone over 45. The shoulder angle is particularly important and frequently missed. There is a specific type of lung cancer called a pancoast tumor that develops in the very top of the lung. As it grows, it presses against the brachial plexus, which is the network of nerves that runs from the spine through the shoulder and down the arm. The result is persistent shoulder pain, sometimes with weakness or numbness running down the arm, that most people assume is a rotator cuff problem or a pinched nerve from poor posture. Chest pain that worsens with deep breathing or coughing can indicate that the tumour has grown to involve the pleura, the outer lining of the lung. This is the tissue that does have pain receptors. When it becomes involved, the body is signalling that the cancer has extended beyond the lung tissue itself. Fatigue is one of the most common symptoms in medicine, which is exactly why it is so easy to explain away. We are all tired. Work, stress, poor sleep, getting older. But cancer-related fatigue has a distinct character. It is fatigue that is disproportionate to your level of activity, that does not improve with rest, and that has appeared without an obvious life explanation. The mechanism here is fascinating and often overlooked. Tumours alter the body's immune response in a way that triggers the chronic production of inflammatory proteins called cytokines. These cytokines, which are the same molecules responsible for the exhaustion you feel during a severe infection, create a state of low-grade systemic inflammation that the body interprets as an ongoing illness. Research published in the Journal of Clinical Oncology has documented this pathway, showing that fatigue in early lung cancer is not simply a consequence of reduced oxygenation, but a direct product of tumor-driven immune activation. If you have been persistently exhausted for more than a few weeks without a clear reason, that pattern deserves a clinical conversation. Losing weight without trying to is one of medicine's most important warning signals across virtually every cancer type. The threshold that clinicians use is roughly 10 pounds or 4 to 5 kilograms over a period of 6 to 12 months without a change in diet, exercise, or lifestyle. What is happening is a process called cancer cachexia. The tumor alters the body's metabolism at a fundamental level. It increases the body's energy expenditure, suppresses appetite through hormonal signals, and drives the breakdown of muscle and fat stores. This is not the body being depleted by the tumor consuming calories. It is the body's own metabolic programming being hijacked by signals the tumor releases. Unexplained weight loss combined with any of the other signs on this list should prompt urgent medical assessment. On its own, it still deserves a conversation with your doctor. When a section of the lung is partially blocked by a tumor, it creates a trap for bacteria. Air and secretions cannot move freely through that segment of the airway, which creates the ideal conditions for infection to take hold repeatedly. If you have had 2 or more chest infections within 12 months, or if a pneumonia has kept returning to the same part of the lung, this pattern is a flag that something structural may be obstructing that airway. What makes this sign so easy to miss is that the infections are real and they do respond to antibiotics. Each episode gets treated and resolves, but without addressing the underlying blockage, the obstruction remains and the infections keep coming back to the same place. Any recurrent chest infection deserves a chest X-ray to look at what might be causing the vulnerability in that specific area. A voice that has become hoarse, raspier, or weaker than usual in the absence of a cold or laryngitis, and that has persisted for more than 3 weeks, can indicate that a tumor in the chest is pressing on the recurrent laryngeal nerve. This nerve runs an unusually long route from the brain, down through the chest, looping around major blood vessels near the heart, before returning up to control the vocal cords. Because of this anatomical path, a tumor in the mediastinum, the central cavity of the chest, can compress or invade this nerve long before it produces any other symptoms. The result is a voice change that most people attribute to aging, overuse, or a lingering cold. This is one of those signs where the anatomy is giving you a very specific clue about what is happening inside the chest if you know to look for it. This one tends to alarm people when it happens, but many do not connect it to the lungs. The superior vena cava is the large vein that returns blood from the upper body, your head, neck, and arms, back to the heart. It runs directly through the chest, and a tumor in the right lung or in the central lymph nodes of the chest can compress it. When the superior vena cava is compressed, blood backs up in the veins it drains. The result is progressive swelling in the face, neck, and arms, often with a visible engorgement of the veins in the neck, and sometimes a bluish tinge to the skin of the face. This is a medical situation called superior vena cava syndrome, and while it tends to appear at a somewhat later stage than the other signs on this list, recognizing it immediately and seeking emergency care can be critical. This final sign is one of the most remarkable in all of medicine, and it is one that almost no one knows about. Finger clubbing is a change in the shape of the fingertips and nails, where the ends of the fingers become rounded and bulbous, and the nails curve downward over them. It develops slowly over months and is painless, which is why it routinely goes unnoticed. The mechanism behind it is not completely understood, but research published in the European Respiratory Journal has pointed to the role of a platelet-derived growth factor released by tumours. This factor drives abnormal tissue growth at the fingertips as a systemic effect of the cancer. Clubbing is strongly associated with lung cancer and is present in a significant minority of early-stage patients. Related to this, some lung tumours release substances that mimic hormones and stimulate abnormal bone growth, particularly at the wrists, ankles, and shins. This condition, called hypertrophic pulmonary osteoarthropathy, produces a deep aching bone pain that most people assume is arthritis. It is one of the clearest examples of how a lung tumour can speak through the skeleton before it ever speaks through the lungs. So what is the solution? I want to frame this very carefully because I am not advocating for fear or panic. I am not suggesting that anyone experiencing one of these symptoms definitely has lung cancer, and I am certainly not suggesting that you try to manage this without involving your doctor. What I am saying is that if you recognize one or more of these patterns in yourself or someone you love, it demands a clear, structured response, not the quiet hope that it will resolve on its own. The first and most important step is to see your doctor and be specific. Do not walk in and say you feel a bit off. Say exactly what you have noticed, how long it has been happening, and whether it has changed. Bring this list if it helps you remember. In medicine, the history is everything. A well-described symptom pattern is far more valuable than a vague complaint. The second step is to ask specifically about a chest X-ray if you have respiratory symptoms, and to understand that a chest X-ray, while useful, is not infallible for early-stage lung cancer. Small tumours, particularly those in certain locations, can be missed on a standard X-ray. If your symptoms persist after a normal X-ray, you have every right to return and ask for further investigation. Research published in the Lancet Respiratory Medicine has shown that low-dose CT scanning is significantly more sensitive than chest X-ray for early lung cancer detection in higher-risk individuals. The third step, and this is crucial, is to understand your personal risk profile. Smoking history is still the dominant risk factor, but it is not the only one. Exposure to radon gas in the home, asbestos, certain industrial chemicals, air pollution over decades, and a family history of lung cancer all meaningfully elevate risk. If you are in a higher risk category and you are over 50, a conversation with your doctor about lung cancer screening is a reasonable and evidence-based thing to request. I want to be very clear that I am not suggesting anyone self-diagnose or make decisions without their doctor's involvement. What I am saying is that the healthcare system, as wonderful as it is, operates reactively. It waits for you to bring a concern to it. The people who benefit most from early detection are the ones who recognize the signals, take them seriously, and advocate for themselves in the clinical setting. And here is the most empowering thing I can tell you about this. When lung cancer is caught at stage 1, when it is still small and contained within the lung, surgery is often curative, not life-extending. Curative. We are talking about potentially having the tumour removed and never having it return. That outcome is not available to most of the patients I have seen arrive in the emergency department, but it is available to people who know what to look for and act on it. The fourth practical step is to reduce your ongoing risk. If you smoke, this is the most important single thing you can do for your lung health. But even for non-smokers, testing your home for radon gas is a straightforward and inexpensive step that is dramatically underused. Radon is the second leading cause of lung cancer after smoking, and it is completely odorless and invisible. You would never know it was there without a test. Let me bring this back to what I see clinically, because I think it genuinely helps to anchor the biology in real patient outcomes. The pattern I have seen repeatedly in the emergency department is this. A patient arrives with what appears to be a severe pneumonia, or a clot in the lungs, or a fracture from a seemingly minor fall. We treat the immediate problem, and then during the investigation, we find a tumour that has been there for a year or longer. When we review their history, which I always do, we often find a trail of symptoms that were each individually explained away. A cough that was attributed to a postnasal drip, a hoarse voice that was blamed on shouting at a football match, shoulder pain that was treated with physiotherapy for months. None of these patients did anything wrong. That is the most important thing I want you to hear. They were not negligent. They were not ignoring their health. They simply had not been given the framework to recognize what their body was telling them. The system did not give it to them, and that is the system's failure, not theirs. What is remarkable is how different the story can be when these signs are acted on early. I have spoken with patients who came forward with a persistent 3-week cough, who turned out to have a stage 1 lesion that was removed laparoscopically, and who went on to have entirely normal post-operative lives. The cough was not dramatic, the cough was not alarming, it was just persistent, and persistence was enough to save their life. Now, let me zoom out to the bigger picture, because I think what we have covered today is about far more than lung cancer specifically. Your body is always communicating with you. It is not a silent machine that one day simply fails. It is a system of extraordinary complexity, and it produces signals when something is not right. The signals are not always dramatic. In fact, the most important signals are often the quietest ones, the ones that do not fit the pattern of what you have experienced before, the ones that linger when they should have resolved, the ones that you find yourself making small adjustments to accommodate without consciously realizing you are doing it. The philosophy that has driven everything I have learned in emergency medicine is this: the body rarely lies. It may obscure the truth, it may express it in an unexpected language, but it does not lie. Learning to listen to that language is one of the most valuable things you can do for your long-term health. The mechanisms that allow lung cancer to hide early, the absence of pain receptors in lung tissue, the functional reserve that masks early capacity loss, the way systemic symptoms can appear before local ones, are the same mechanisms that make early detection so powerful. Once you understand the biology, these 11 signs stop being random and start being a coherent pattern of a body that is trying to get your attention. And paying attention to that pattern is what changes outcomes. When you address this early, you are not just treating a cough or investigating a shoulder pain. You are potentially catching a disease at the one point in its development where the outcome can be genuinely different. That is the real prize here. Emotional recap plus final CTA. So let me bring this full circle. Lung cancer does not stay hidden because you have not been paying attention. It stays hidden because the signals it produces in its early stages are designed by biology to be quiet, dispersed across different body systems, and entirely plausible as ordinary complaints. The system has not given most people the knowledge to interpret those signals differently. That is what today was about. The solution is not fear. It is awareness and action. A cough that lasts more than 3 weeks. A voice change that persists. Breathlessness that has been slowly creeping into activities it never used to affect. Unexplained weight loss. Shoulder pain that does not respond to the usual treatment. These are the whispers, and now you know to listen for them. Tell your doctor clearly. Advocate for investigation. Know your risk profile. And if something does not resolve in the expected time frame, go back. Early detection is not luck. It is knowledge applied at the right moment. And finally, if you found this video useful and you think it could help someone you know, please share it with them. And if you have not already, hit the subscribe button and like this video so we can reach more people who need this information. It genuinely makes a difference.